Have you ever wondered whether your allergy tablets are safe to take alongside your ADHD medication? It's a really common question, and the answer depends on which allergy remedy you're reaching for. If you're managing ADHD with stimulant medication in the UK, you might already know that Adderall isn't actually licensed here. Instead, doctors prescribe amphetamine-based alternatives like lisdexamfetamine or dexamfetamine in line with NICE guidelines. The interaction guidance we're covering today applies equally to those medications. Now here's the thing, allergy remedies are everywhere, on supermarket shelves, in pharmacies, available without a prescription. It's easy to assume they're completely harmless, but some of them can interact with stimulant ADHD treatments in ways that are worth knowing about. Let's start with the good news. Non-sedating antihistamines. Things like cetirizine, loratadine, and fexofenadine, sold under brand names like Zyrtec, Claritin, and Telfast, have no clinically significant interaction with stimulant ADHD medications, according to the BNF and UK prescribing information. These are generally the preferred antihistamine choice alongside stimulant therapy, so ask your pharmacist which option is most suitable for you. Sedating antihistamines are a different story. Older first-generation antihistamines like chlorphenamine, that's Piriton, and promethazine cause CNS depression. That means they can blunt the benefits of your stimulant medication, cause unpredictable drowsiness, and may make ADHD symptoms appear worse. Where possible, use a non-sedating alternative instead. Then there are decongestants, and this is the category that carries the highest concern. Oral decongestants containing pseudoephedrine or phenylephrine, found in many cold and flu remedies, have what's called additive sympathomimetic effects when combined with stimulant medications. In plain terms, both act on the same pathways in the body, and together they can raise blood pressure, increase heart rate, and heighten the risk of anxiety and insomnia. These combinations should be avoided unless you're under direct medical supervision. One thing worth flagging, always check the label carefully. Some allergy and cold products combine an antihistamine with a decongestant like pseudoephedrine or phenylephrine, even if they're marketed as non-drowsy. If you're unsure what's in a product, ask your pharmacist before you buy it. So what are the safest options? Intranasal corticosteroids, nasal sprays like fluticasone, which is flixenase, or beclometasone, which is Becanase, are actually the first-line recommendation for allergic rhinitis according to NICE. They work locally in the nasal passages with very little absorption into the rest of the body, and there's no known interaction with stimulant ADHD medications. Mast cell stabilizers like sodium chromoglycate nasal spray or eye drops are also considered suitable with no known interaction, particularly useful if eye symptoms are a problem. And simple saline nasal rinses have no pharmacological interaction at all. If you're on stimulant ADHD medication and managing allergies, it's worth discussing your options with your GP or pharmacist. Mention any over-the-counter allergy remedies you're already taking, even if they seem minor. And at your annual ADHD review, make sure you disclose all allergy medications, including anything bought without a prescription. On the safety side, if you notice a significant increase in your heart rate, a rise in blood pressure, increased anxiety, difficulty sleeping, or any other new or unusual symptoms after starting an allergy medication, contact your doctor. In the UK, you can also report suspected side effects through the MHRA's Yellow Card scheme. Your pharmacist can help you with that. And as always, nothing in this video replaces personalised medical advice. Please speak to your GP, pharmacist, or specialist before making any changes to your medications. So to recap, non-sedating antihistamines like cetirizine and loratadine are generally safe alongside stimulant ADHD medications. Sedating antihistamines and oral decongestants carry meaningful risks and should be avoided where possible. Watch out for combination products that mix antihistamines with decongestants. And intranasal corticosteroids are the first-line recommendation for allergic rhinitis, with no known interaction with stimulant therapy. If this was helpful, drop a comment below, especially if there's another medication question you'd like us to cover. Give this video a like and subscribe to the Bolt Pharmacy channel for more medically reviewed health information.